A new weapon in your arsenal, Steve, to turn back the hands of time. We're checking out what's called a liquid facelift. It uses Sculptra. It's this filler that was just approved by the FDA for use here in the U.S. It can rebuild that volume that we lose, you lose as y'all age. Aggie Smythe wants to look in the mirror and see a younger face.
My skin doesn't have the fullness that it used to, and I'm really troubled around my eyes, that I have a hollowness around my eyes, so I wanted to do something about that.
Dr. Doug Mest in El Segundo recommends Sculptra to take the years off.
Sculptra works by naturally producing the patient's own collagen in reaction to the material. So it's very gradual and natural in its production of collagen and long-lasting.
Aggie's before and after photos show that Sculptra doesn't fill lines, rather it slightly plumps certain areas to simulate a youthful look. These photos from the company that makes Sculptra show a more dramatic change over 7 months, the younger look Aggie is looking for.
We were able to reproportion her face and add volume and youthful contours back where she had very harsh contours.
And Aggie loves it.
I can already see the fullness that Dr. Mest was talking about. It's definitely come back, so I'm very pleased with it so far, and I know it's just going to get better.
And the doctor says in 6 months, perhaps 1 or 2 more treatments, she will have that much younger looking face because it kind of builds upon itself and then it builds the collagen as it's in there. Another benefit of Sculptra, it lasts 2 years, twice as long as other injectables.
How much? About 20 bucks? 20 bucks?
You know, a little bit, you know, it can be $500 to $1,000 and up depending on how much.
What will Steve's downtime be? How long will he have to be off the air?
No bruising, Steve, so you could be back on
So
the air by tomorrow.
I could be back for like the 9 o'clock hour.
Exactly.
Dr. Douglas Mest takes on Jim's case.
Jim, what brings you in today?
Just a lot loss of fat in my face. You know, the shrunken in cheeks and my temples.
What have you tried, if anything, to correct this fat loss?
Just shoveling food in my mouth. You know, high calorie stuff, but it's filled out maybe a little bit. You know, maybe in here, but nothing within my cheeks and my temples.
This is not a lack of nutrition per se.
Right.
This is actually something wrong with the fat cells. The cause of facial wasting is actually unknown. It's multifactorial. There are certainly things that we know, such as age, genetics. Whites tend to get it more than blacks, men more than women. Certainly there's a strong association with certain of the HIV medications, but there's actually no specific actual cause yet that we've found. Because of the current surgical implants, surgery is not the answer for this condition. And so we need to fill the defect that's there. We need to fill the fat with something else.
Were we able to do my cheeks and my temples at the same time?
We'll do the whole treatment.
I'm really excited. I'm really looking forward to this.
Today, Jim will undergo the first of several Sculptra treatments to fill out his face.
Collagen is a naturally occurring part of the skin. It's what gives the skin its strength. The Sculptra particles stimulate the body to produce collagen. They, in turn, then are made to be biodegradable and dissolve, and your patients are left with their own collagen as the fill. Jimmy, you ready?
I'm as ready as I'm going to be.
This is the easy part. Right. Then turn your head to the side. The Sculptra material is a powder, and so we need to reconstitute it with water to make it injectable. In the temples, we actually go very deep, actually into the muscles. Revolumizing is the new fountain of youth. Volume is actually the key to a successful correction of facial aging. In fact, a number of plastic surgeons are utilizing this technique after a facelift. The flat, pulled look is not a youthful look.
Diseases like AIDS are some of our best teachers in medicine. Jim Oyler's condition is actually an accelerated version of what happens to all of us as we age. There's loss of fat and bone, and the skin loses its elasticity, making us appear older. Fillers address this process by mimicking structures that already exist in the body without harmful reactions. There's no doubt that cosmetic injectables are the future of plastic surgery.
Oh my God, look at that. Wow. I haven't seen my face looking like this in, I would have to guess, 10 years. I hardly recognize myself.
Over the next few days, the volume Jim now sees will disappear. In time, however, new tissue will bring lasting results to his appearance.
I want to see you in 4 to 5 weeks, okay?
Great, thank you.
You're welcome.
And after only 2 treatments, Jim's already looking more like his old self.
I feel that I can walk down the street, hold my head up, smile, meet people in the eye. After the second application, my face is more linear now. My cheeks are fuller.
It is miraculous how much more it's changed, and I'm really thrilled to see the final product.
4 more treatments after this, 5 weeks apart. If I can look better, that's even better. But if this is all that I were to get, I'd be happy with it.
I am Alvin Glassgold, founder of the Glassgold Group. Rhinoplasty is my passion. Many years of experience and thousands of rhinoplasties have taught me the many nuances and complexities of this operation. In striving for a successful outcome, which means a well-satisfied patient, we must listen to the patient's goals, evaluate the nasal structure, and establish an appropriate game plan. Our objective is to create a nose which appears aesthetically well-balanced and appropriate for each individual patient's face. In order to accomplish this, we must consider the following. The female should have a more feminine nose, as we see here. The male requires a stronger, more masculine nose. We must consider ethnicity. The typical Caucasian nose requires hump removal and reduction in size. The African American or black patient usually requires significant nasal narrowing and frequently a building up the nasal bridge. This is also true when we consider rhinoplasty in the Asian patient, as we can see in this individual. Our approach to rhinoplasty has evolved over the years, and we now utilize an open structure technique which allows us to make more precise change and have much more predictable outcome. It has eliminated the use of nasal packing and results in a more pleasant and briefer recovery time. I'd like to indicate some of the salient features we address in rhinoplasty. First, we'll talk about the profile. Most commonly, we are reducing an over-projecting nose, removing a bump at the bridge, as well as reducing overall nasal size. In addition, the following are changes that we must be able to accomplish in rhinoplasty. Reduction of the over-projecting tip, as we can see in this individual. Also, shortening the long nose, which droops over the lip. This is an important consideration. We also want to be able to elevate a drooping tip, as we see in this young man. And when the nose is overly long, we want to be able to shorten it to an appropriate size. Tip contouring can vary from a well-defined tip, as we see here, which some female patients prefer, to a more subtle tip, as we see in this young lady. The male nose generally requires a subtle tip. The decision as to which type we do depends on the patient's nasal structure, skin type, and desire. And this is determined at the time of consultation. Now we should look at the frontal view. And in most cases, the frontal view changes are very subtle and natural, making the effective rhinoplasty not too noticeable. Narrowing the very wide nose is important. A tip which droops with a smile must be corrected and fixed and secured so it maintains proper position even when smiling. Crooked noses must be straightened so that they don't detract from the facial appearance. We also pay particular attention to the nostrils. We want to make sure that they are appropriately sized and contoured. When we analyze the profile, the relationship of the chin to the nose can be very important. A receding chin will make the nose look more projecting, and in some cases, as we see here, we've recommended an augmentation of the chin, which is called a mentoplasty. and this would be performed at the time of rhinoplasty. These are just some of the important aspects of rhinoplasty. Each patient is treated individually. If you're considering rhinoplasty or are unhappy with your nasal appearance, I strongly recommend you seek a consultation so we can evaluate your particular situation and make.
Here's a very short video on how Chesapeake Productions can get all this done and hit this many consumers for such a ridiculously low cost. We want you to help yourself and us reach over 1 million active Maryland consumers every week by emailing talking websites, using AT&T dedicated servers and Linux ProSuite spam avoidance software, and by using 1.6 million opt-in email addresses compiled by companies like US Data in strict compliance with the United States Spam Act.